The way of learning. Today's topic is white blood cells exhibited for staff nurse interns. First question is white blood cells act. Option A as a defense against infection. Option B as source of energy. Option C for clotting blood. Option D as a medium for oxygen transport from lungs. Correct answer is option A as a defense against infection. Next one is which of the following result of the lab test will be significant to the diagnosis A disorder. Option A RBC 4.5 to 5 million cubic millimeter. Option B hemoglobin 13 to 14 gm per dl. Option C platelets 2,50,000 to 5 lakh cubic per millimeter. Option D WBC 12,000 to 13,000 cubic per millimeter. Correct answer is option D WBC 12,000 to 13,000 cubic per millimeter. Next one is which of the following polymorphonuclear leukocytes? Option A neutrophils. Option B eosinophils. Option C basophils. Option D monocyte. Correct answer is option A neutrophils. Next one is cell with a horseshoe shaped nucleus and abundant cytoplasm in a peripheral blood smear is option A neutrophil. Option B monocyte. Option C lymphocyte. Option D eosinophil. Correct answer is option B monocyte. Next one is irregular nuclei are present in option A neutrophils. Option B basophils. Option C eosinophils. Option D monocytes. Correct answer is option B basophils. Next one is patient with prolonged neutropenia more than 10 days are at risk for which infection? Option A herpes simplex reactivation. Option B pneumocystis carinii infection. Option C oral candidal infection. Option D tuberculosis. Correct answer is option B pneumocystis carinii infection. Next one is which among the following do the phagocytic action? Option A eosinophils. Option B polymorphs. Option C basophils. Option D neutrophils. Correct answer is option D neutrophils. Next one is the serological reaction which synthesizes bacteria for phagocytosis is called option A coagglutination. Option B neutralization. Option C opsonization. Option D complement fixation. Correct answer is option C opsonization. Next one is a reduction in total leukocyte count is called option A leukocytosis. Option B leukopenia. Option C leukorrhea. Option D leukemia. Correct answer is option B leukopenia. Next one is which of the following results of the lab test is indicative of the bacterial infection? Option A RBC 4.0 million cubic millimeter. Option B hemoglobin 13.2 gm per dl. Option C platelets 3,50,000 cubic per millimeter. Option D WBC 15,000 millimeter. Correct answer is option B WBC 15,000 millimeter. Next one is which one of the following occurs in allergy? Option A eosinophila. Option B neutrophila. Option C leukocytosis. Option D monocytosis. Correct answer is option A eosinophila. Next one is agranulocytosis is characterized by option A abdominal pain. Option B change in level of consciousness. Option C, stiffness of neck. Option D, leukopenia. Correct answer is option D, leukopenia. Next one is the resistance to infections that an individual has due to his genetic makeup is. Option A, specific immunity. Option B, non-specific immunity. Option C, innate immunity. Option D, local immunity. Correct answer is option C, innate immunity. Next one is neutral killer cells are an example of. Option A, acquired immunity. Option B, autoimmunity. Option C, hypersensitivity. Option D, innate immunity. Correct answer is option D, innate immunity. Next one is a cell that takes part in innate immunity by killing virus infected cell is. Option A, neutrophil. Option B, NK cell. Option C, macrophage. Option D, T cell. Correct answer is option B, NK cell. Next one is body's attempt to fight the effect of noxious substance with all its defensive abilities are known as. Option A, alert reaction. Option B, alarm reaction. Option C, resistance. Option D, exhaustion. Correct answer is option C, resistance. Next one is without an which one we would have no way to fight harmful things that enter our body from the outside or harmful things changes that occur inside our body. Option A, in digestive system. Option B, immune system. Option C, internal organs only. Option D, external organs only. Correct answer is option B, immune system. Next one is the ability of the human body to defend itself against a pathogenic agent. Option A, resistance. Option B, tolerance. Option C, immunity. Option D, adaptation. Correct answer is option C, immunity. Next one is a neutral power of the body to withstand the toxins or the organisms of disease is. Option A, resistance. Option B, sensitivity. Option C, transmission. Option D, immunity. Correct answer is option D, immunity. Next one is primary immune response. Correct statement is option A, involves immunoglobulin G. Option B, antibody producing cells memory B cell. Option C, no lag periods. Option D, slow and slow quiz. Correct answer is option D, slow and slow quiz. Next one is immunoglobulin sir. Option A, glycoproteins. Option B, polysaccharides. Option C, lipoproteins. Option D, amino acids. Correct answer is option A, glycoproteins. Next one is which of the following antibody occurs as pentameric structure? Option A, immunoglobulin A. Option B, immunoglobulin G. Option C, immunoglobulin E. Option D, immunoglobulin M. Correct answer is option D, immunoglobulin M. Next one is which of the following is true about immunoglobulin M? Option A, it is the smallest antibody. Option B, it forms the initial immune response. Option C, it is not an isotope of antibody. Option D, it is not produced by vertebrates. Correct answer is option B, it forms the initial immune response. Next one is which of the subclasses antibody is induced in primary immune response? Option A, immunoglobulin G. Option B, immunoglobulin M. Option C, immunoglobulin E. Option D. Immunoglobulin A. Correct answer is option B. Immunoglobulin M. Thanks for watching. Like, comment and subscribe the channel.